Hello everyone, welcome back to our YouTube channel Sowkya Med Vision. Today we are going to start our new series of bones of upper limb, the clavicle, scapula, humerus and bones of forearm, ulna, radius, and today we are going to start with clavicle. In the last class we have discussed about the introduction to upper limb, the main functions, evolutionary changes of upper limb, comparison between upper limb and the lower limb and the bones of upper limb. Today we are going to see the clavicle. Clavicle. It is a horizontal long bone. Clavicle is a long bone which is situated horizontally. Every long bone in our body like humerus, femur, tibia, ulna, radius, these are the long bones which are presented vertically. Right? See, this is the humerus. This is the humerus bone of arm which is presented vertically. These two are the bones of forearm which are presented vertically, but the clavicle is exceptionally long bone presented horizontally. Clavicle is also known as collarbone, the beauty bone, which is very prominent at the root of neck. And now this is the clavicle situated horizontally at the root of neck, having two ends. The end towards the axial body is known as medial end. The end away from the axial body is known as lateral end. And see the shaft which is very curved, S-shaped. Let's see. This is our beauty bone, clavicle. This is the S-shaped, curve-shaped shaft. This is the lateral end and this is the medial end. The medial end of the clavicle is also known as sternal end. Why? It is the medial end of the clavicle is articulated with the sternum. Sternum is a bone that is present anteriorly in the thorax region. So the medial end of the clavicle is articulated with the sternum and first rib cartilage. Hence it is known as sternal end. And here the lateral end is also known as acromial end. Why? The clavicle, the lateral end of the clavicle is articulated with the acromion process of the scapula, forming what? Acromioclavicular joint. And here, so hence it is called as acromial joint, acromial end. So lateral end is acromial end and the medial end is the sternal end. And shaft is S-shaped, horizontally presented, and the collarbone, the clavicular bone, the beauty bone is subcutaneously presented, which is not so deep. It is subcutaneously presented throughout its length. Now let's see the features of the clavicle. As we said, clavicle is a collarbone. It is a beauty bone. It is a horizontal bone, long bone presented horizontally. As we said, any long bone, that is every long bone is presented vertically. Exceptionally, clavicle is presented horizontally. As we said, the medial end articulated with the sternum and first rib cartilage, forming what? Joint, sternoclavicular joint. And the laterally articulates with acromion process of scapula, forming acromioclavicular joint. Now let's see what are the peculiarities of the clavicle. See, as we said, long bone should present vertically, but here it is presented horizontally, which makes peculiarity of the clavicle. And every bone, any bone in our body contains medullary cavity. Any bone in our body containing medullary cavity, exceptionally clavicle, in which medullary cavity is absent. Now, as I said, the clavicle is presented prominently at the neck region because it is subcutaneous. It is not so deep as other bones. See the arm bones, the humerus is very deep. It is not superficial. If it is superficial, we can easily access, we can easily prominently see that bone. But here clavicle is not so deep, but it is kept subcutaneously. And any bone, its shaft is ossified from only one primary center. Any bone is ossified only from one primary center, but the clavicle clavicle is developed, ossified from two primary centers. Yes, there may be any number of like more than two or three, there are 8 number of secondary centers, but any bone containing only one primary center for ossification, but the clavicle containing only two, which is not present in any bone. And this is the first bone. Clavicle is the first bone that is going to ossify in the human body. That is at 5th to 6th week of intrauterine life. In the fetus stage only it is going to be start ossification. And it is the only bone that it completes its ossification at the last. Yes, this is the only bone that starts first ossification and completes last ossification. And ossifies in membrane, yes, which makes the clavicle again peculiar. Any bone in our body is cartilaginous ossification. See, there are 2 types of ossifications, membranous and cartilaginous. All bones are cartilaginous ossification except clavicle. Yes, in that clavicle only medial end, that is sternal end. See, this part is the sternal end, that is medial end, is cartilaginous. Hence, the clavicle is membranocartilaginous ossified bone. Yes. Now, let's quickly review our parts of clavicle. Now, it has 2 ends, as we said, lateral end and medial end, and a shaft. Yes, it is S-shaped. Ends are lateral and medial. It is known as acromial end, whereas medial end is known as sternal end. Sternal end is articulated with clavicular notch of manubrium sterni. Now, what is manubrium sterni? Manubrium sterni is the first part of sternum. Yes, this is how sternum is present. This part of sternum is known as manubrium sterni, containing a notch to articulate for the articulation of clavicle, medial end of the clavicle, forming sternoclavicular joint. Yes. Now, the lateral end, acromial end, articulates with the acromion process of the scapula, forming acromioclavicular joint. Yes. Now, the shaft, which is a S-shaped, curved. Yes. Which is developed from what? 2 primary centers. Yes. 2 primary centers, which is peculiar in clavicle. It has 2 parts again. The lateral 1/3 and medial 2/3. See, let's divide into 3 parts. This become the medial 2/3. This becomes the lateral 1/3. Yes, this is the lateral 1/3. This is a medial 2/3. Yes, the lateral 1/3 flattened and concave forward concavity. See, this is a concavity laterally. Yes, which is flattened. And again, medial 2/3 is round and convex forward. See, this is convexity. Convex forward. You got me, right? And now, let's see the features and attachments of the clavicle. See, the lateral end is also known as acromial end, contain what? Oval facet. For what? Articulation with what? Medial margin of acromion process. As we said, lateral end is the acromial end. Why? By the name, it articulates with the acromion process of the scapula. Yes, and now medial end is also known as sternal end. Presents a saddle-shaped articulate surface. For what? Obviously, articulates with clavicular notch. As we said, clavicular notch of manubrium sterni to form what? Sternoclavicular joint, which is the joint which attach upper limb to the axial body. Articulation between the upper body and the upper limb. Yes. Shaft containing again 2 parts, lateral 1/3, medial 2/3. Lateral 1/3 contain 2 surfaces. As we said, it is flat, so it contains superior and the inferior. 2 borders, anterior and the posterior. Now, surfaces. Superior surface is subcutaneous. Superior surface is subcutaneous. As we said, the whole length of the clavicle is subcutaneously presented. Yes. So, this is the superior. Let's imagine this is the clavicle. Yes. This is the superior surface, this is the inferior surface. This will be the anterior border, this will be the posterior border. The superior surface is subcutaneous. This is prominent, presented between trapezius and deltoid muscles. See, this is the lateral 1/3. This is the anterior border, posterior border. Up will be the superior surface. This is the inferior view. This will be the inferior surface. Yes, the superior surface having two muscles attachment as in the inferior surface. Trapezius muscle का insertion and deltoid muscle का origin. Pink color denotes origin, whereas blue color denotes insertion. So the same in the inferiorly deltoid muscle origin, trapezius muscles in insertion. Yes, see, superior surface, as I said, it is subcutaneous between attachment of deltoid and trapezius. See, this is the deltoid, this is the trapezius. Between these is known as superior surface. Inferior surface, yes, here is the inferior surface. Lateral 1/3 inferior surface. Here is the ligament. What is the ligament? Corococlavicular ligament containing two parts, trapezoid part and the conoid part. These are the two parts of the corococlavicular ligament extending from coracoid process. What is a coracoid process? Process of scapula. In the next class we are going to get that. From coracoid to clavicle. So for the attachment of corococlavicular ligament in the inferior surface of the lateral 1/3 of clavicle, we have trapezoid tubercle and conoid tubercle. See, trapezoid ridge and the conoid tubercle for the which provides attachment of corococlavicular ligament. Yes. Now let's see the borders of lateral 1/3. As we said, it contains anterior and the posterior border. Anterior border is concave. Again, see, this is the concave. Posterior is which is convex, as we see like this. This is the concave, and the posteriorly that will be the convex. Yes. And now the anterior border gives origin to deltoid muscle. As we said, this will be the deltoid muscle. Posterior border, insertion of trapezius. This is the posterior border, gives insertion for the trapezius. And now medial 2/3. We completed the lateral 1/3 containing two surfaces, two borders. Superior surface, inferior surface. Anterior border, posterior border. Superior surface and anterior border gives deltoid muscle. Inferior surface and posterior border, insertion of trapezius muscle. Yes. Now medial 2/3, which is quadrilateral, containing four surfaces. Quadri means what? Four, right? So four surfaces. Anterior surface, posterior surface, superior surface and inferior surface. Yes. Anterior surface is convex forward. See, this is the anterior surface which is convex, right? Posterior surface is concave. So anterior surface give origin for clavicular head of pectoralis major. What is a pectoralis major? It is a major muscle in the pectoralis region. There is another muscle, pectoralis minor. Okay, so you have to remember this, that the origin of clavicular head of pectoralis major. Now posterior surface is which is a concave backward. This is concavity backward. Now it gives the origin to sternohyoid. It is the muscle starting from sternum to hyoid bone. Also it is related to third part of clavicular artery, subclavian artery, containing three parts. Part 1, Part 2, Part 3 and. So the third part of subclavian artery is related to posterior surface of the medial 2/3 of clavicle. Also it is related to trunks of brachial plexus, which is the main nerve supplied to the upper limb. And now superior surface. Superior surface gives origin to clavicular head of sternocleidomastoid. From the word meaning, sterno means sternum obviously. Cleido means clavicle. The muscle extending from sternum and clavicle is inserted at mastoid. Yes. So it is known as sternoclavicular mastoid. So the superior surface give clavicular head of sternoclavicular mastoid. And next, the remaining surface is the inferior surface of the medial 2/3 of clavicle. See, It is a costoclavicular ligament. It is something related to costoclavicular ligament. Costo means what? Ribs. So this ligament is helping in attachment of clavicle with the costal and insertion of subclavius muscle. See, this is the inferior surface, right? This is the subclavius muscle. This is the subclavius muscle. Blue color indicates what? Insertion. So subclavius means what? Below the clavicle. Clavius is a clavicle bone. Sub means below clavicle. So the muscle is extending from first rib, superior surface of first rib to inferior surface of the clavicle. So it is known as subclavicle. So it is inserted at medial 2/3, inferior surface of the medial 2/3 of the clavicle. Also, it has clavipectoral fascia. It is a deep fascia. Deep fascia extending from clavi. Clavi means obviously clavicle. Pectoral means pectoral region. And it contains nutrient foramen of clavicle. Inferior surface containing a nutrient foramen. For what? To enter, to pass, to transverse nutrient artery for the bone, for the more nourishment. Yes. And let's see the ossification. As we said, it has two primary centers, which makes it exception, and also membranocartilaginous, again exception, and it has two secondary centers, one for sternal end, one for acromial end. Yes, two primary centers appears in 5th to 6th week of intrauterine life and fused by 45th day of intrauterine life, and the sternal end, center for sternal end, appears at 20 years and fuse at 25, and acromial end immediately they fuse after appearance. Yes, let's quickly review our lecture. Clavicle, collarbone or beauty bone containing two ends and one shaft. Sternal end, acromial end. Why sternal end? Articulation with the sternum. Why acromial end? It is articulation with the acromion process of the scapula, containing two surfaces. The lateral 1/3 containing two surfaces, superior and inferior, anterior and posterior border, and medial 2/3 containing four surfaces, which is quadrilateral. So superior, inferior, anterior and posterior surfaces. Yes, the inferior surface containing nutrient foramen. Yes, and this is the complete brief discussion about the clavicle. If you understand, please do like and subscribe the channel. Thank you.